Hi, my name is Sabrina Das, and this is my presentation on multicultural sensitivity training in hearing healthcare. So I want to talk to you about my why behind this project. Hearing loss is the #1 sensory disorder on the planet. It affects over 500 million people. So hearing healthcare professionals work with people from all over the world and from various cultural backgrounds. But multicultural sensitivity training is lacking. There's no standardized training for this issue. There's no standardized training to help prepare hearing healthcare workers understand and work with people who don't have the same culture that they do. So for this project, we interviewed 20 different subjects from the hearing healthcare field. We asked them a list of standardized questions. We collected data from March to October of 2020. We asked them questions about their experience with multiculturalism, how it affected their job, how they personally deal with it, how their opinion about the multicultural sensitivity training program and what they would want to see from a program like that. So we learned very quickly that hearing healthcare professionals travel a lot. So combined, our subjects went to 35 different countries. So they often travel for mission trips through different organizations, and that payment for that can come through fundraisers or donations, or they're self-funded. Sometimes their trips were through schools, so they were scholarships. Sometimes their trips were manufacturer sponsors. Some were grants. Other times they just had to travel for their job, so they got job reimbursement. And, we talked to them about their trips and very quickly realized that they often didn't get training for the multicultural context that they were about to enter into. When we asked them if they received any training on multicultural sensitivity before they left the country, only about 21% of them said yes. So that was close to 80% of these hearing healthcare professionals received no training on multicultural sensitivity before they left the country. We also asked them who provided this training, and about 9% of them it was self-sought. About 32% of them it was organization provided, but again, that close to 60% had no training whatsoever. And then we asked them what the multicultural sensitivity training was like. Some of them said it was like an attitude approach that said, be flexible, or, go with the flow, do as the Romans do. Some of them, it was an academic approach in a classroom setting where they were informed about the country that they were going into. Some of it was native-driven training, where once they were on the ground, they got a lot of information or education from the people who lived there, and then some people as a workplace or community outreach type of program. But then again, the majority of our subjects had no training at all. So we next talked to them about managing multiculturalism and what that looked like. So we asked them, how do they prepare for multicultural context? So a lot of them said that they read up, and for some people that was reading local literature, and for other people that was picking up a travel pamphlet from the airport. A lot of them, they learn language. Some people just Google. Some people, again, turn to an academic source like a seminar or a webinar in this day and age. Again, some people rely on that native relationship as a resource to help them prepare. But then, like I mentioned before, a lot of people have no personal prep at all. So we also talked to them about what they wish they had known. We also talked to them about what they wish they had known. A lot of people said that they wanted more language, particularly language that was relevant to what they were doing. A lot of people said that they wish they knew more about the cultural norms or laws, like how in some countries you can't have your feet showing or you can't drink walking down the street. Particularly the female providers mentioned that they wish they knew more about how women and children interact in the culture that they entered into, particularly could they be in a room alone with a male patient, or vice versa? Could a male provider be in a room alone with a female patient, or was that super frowned upon in that culture? And, a lot of them mentioned that when they figured out those things in the moment, they had to quickly adjust. So it was just stuff that they wish they had known before they had stepped into the cultural context. So next, we asked them the question, is multicultural sensitivity training important? So the main question that we asked our subjects, and the main question that was really the main question of our study overall, was would this multicultural sensitivity training actually affect patient outcomes? So we asked our subjects, do you think multicultural sensitivity training could improve patient outcomes? And 95% of them said yes. And remember, that's 95% of these providers saying, yes, I think that multicultural sensitivity training could improve my patient outcomes. But like we mentioned before, the majority of this training just doesn't happen. So then our next question was, what would be important to you in a multicultural sensitivity training program? So we kind of split their answers into two main categories. The purple is the content and the yellow is the format. So in terms of content, they asked that they would love to see, or they said that they would love to see language lessons that had relevant vocab and relevant words to know as a hearing healthcare provider. They want to have a class that helps them challenge and overcome their internal bias that they may not know that they have. A class in cultural norms for the country that they're traveling to, particularly how hearing loss may be viewed in that country. In terms of format, they asked for accessible, short online classes, which, makes sense. Native-driven classes was another big request, considering that a lot of people said that once they were in country, their native resources were super helpful. And they also mentioned assigning someone to the role of multicultural educator and having someone kind of be that touch person for multicultural questions and multiculturalism in general. So, in conclusion, hearing healthcare professionals travel all over the world to help provide care, as well as provide care in country to people from various cultural backgrounds. But 80% of them don't receive the formal training to do so. And that's despite the fact that 95% of them feel like having this training would improve patient outcomes. So the next steps would be to create an accredited continuing education program through the Academy of Audiology or through ASHA to help address this issue or address this need in the field. Thank you so much for listening. Here are my resources. I hope you enjoyed my project.